I'm Daniel Webster. I'm Professor of Health Policy and Management and Deputy Director for Research for the Johns Hopkins Center for the Prevention of Youth Violence at the Johns Hopkins Bloomberg School of Public Health. Safe Streets is modeled after a program from Chicago called Ceasefire. It's a public health approach that ultimately tries to change behaviors to reduce the use of violence. It does so by using street outreach workers who work with high-risk youth in dangerous neighborhoods and help steer them to safer alternatives, new ways to respond to conflicts as alternatives to violence. Our study was the first replication of Chicago's Ceasefire program. We examined the program in 4 neighborhoods in Baltimore, in very violent neighborhoods. We compared trends in gun violence in those neighborhoods versus other very violent neighborhoods. We found that in 3 of the 4 program areas, there were significant reductions in at least one measure of gun violence. And the other important finding was that where the program was most effectively implemented closest to the ceasefire model, they had reductions of homicides of over 50%. Finally, we also found that youth in neighborhoods in the program areas were much less likely to believe that guns were the acceptable way to respond to conflicts. I think this has very important implications for violence prevention in Baltimore and in cities across the United States and perhaps elsewhere. Baltimore is currently investing in the program in 2 neighborhoods. They recently got a federal grant to expand that program into at least 2 other areas. We actually are involved in another project where we hope to implement a similar type program in Park Heights in Northwest Baltimore. And I think this really shows us that this is an effective model. It was unknown whether a program that was developed in Chicago, really for Chicago purposes, with its long history of large gangs, could that translate into a context like Baltimore, where the gang situation is very different. And what we found is, yes, it could. It could work, but really the key is effective implementation.